Welcome to the Social Newsroom. My name is Kate Rira. We are live from the Semabox Studios here in Nairobi. A beautiful day today as we discuss the future of forensic science. And my guest today is Dr. Kizzie Shako. Dr. Kizzie Shako is a forensic medical specialist, an SGBV expert, as well as Kenya's first forensic female police surgeon. I know that is what you see every time you see on the internet, but one of the most beautiful things to understand about Dr. Kizzie Shako is her passion in SGBV and, of course, sending the message to the world with her NGO, which is Vunja Kimya. Among many other projects, Dr. Kizzie Shako has been able to send the message that women need to be protected, and even more so, forensic science has to be given the forefront when it comes to investigation, among many other issues in crime and solving them right here in the country. Let's get into it. Of course, remember, you can always give us your hashtag on @thesocialnewsroom on Facebook and Twitter. Welcome to the show.
Thank you. Thank you so much for having me here.
It's so great to see a woman in a very male-dominated field. I know you get that a lot.
Yes, I do.
The decision to become a forensic scientist, was it off the bat, or was it when you were doing your medical course and you decided this is a journey you will take?
Well, that's a good question.
Yeah.
I knew what I wanted to do very early in life.
Yes.
And I thank God for that, because I saw many people in medical school really struggling. Like, do I do pediatrics or do I do this or that? But I knew very early. By the time I was 5, I knew I wanted to be engaged in anything to do with criminal investigations, anything to do with violent crime, because I thought it was quite intriguing.
Yes.
And I didn't know the words. Of course, by then I didn't know the words. I was like, oh, police officers are always where these things happen. So maybe I can be a policewoman. That was shot down very fast.
Why?
I don't know, but the people around me, the adults when I was a child, thought it was just not. No one wants to do that.
It was not the aspirational career
willingly.
At the time. Yes.
Yeah. And also, it's there's a lot of violence involved. I don't know what their problem was. I still would love to do it even now.
Yeah.
Then I thought about journalism, but I didn't want to write too much. I thought journalists, all they do is write.
Yes.
And then I finally found out when I was in my teenage years that the term I'm looking for is forensic pathology. And so by the time I was 16, I knew what I wanted to do.
Yeah.
And so the downside was that I'd have to do medicine first, which is a very long, when you're young, 5 years is a long time, and then specialize in pathology and then forensics. So I wanted to quit at that point. I was like, I can't do another 10 years of school, come on. But my mother insisted. My mom's a dentist, so
Yes.
she was like, trust me, it will pass, don't worry. And that's how I ended up in forensic medicine. So I joined medical school knowing that I was going to be a forensic pathologist, but changed my mind about the pathology part and just did forensic medicine.
It's pretty interesting to figure out yourself early in life, something a lot of young people struggle with. And you decided to pick up a career that is very male-dominated. Between the time you were in school and now, do you feel like the numbers have changed? Do we have more women in forensic science, or is there been an uptick or not?
So there's definitely been an increase. Rise in the number of women interested in forensic sciences as a whole. Forensic science, specifically in terms of those who work in labs analyzing evidence, samples, hair, blood, urine, and all that.
Okay.
That's where I see the numbers have risen significantly, because I'm always getting calls from people saying, I want to do this. Can you mentor me? Can you help me? Can you guide me? And so on.
Yeah.
Forensic pathology, I have not really seen an increase as such. The same forensic pathologists I knew when I won't say the age, but in like 2012 are the same ones I know now.
Okay.
And then in my field is clinical forensic medicine. So my area of specialty is in dealing with those who are alive.
Okay.
Those
who are alive?
Those who are alive. Sorry.
People really expect...
I know.
Not alive, yeah.
Yeah. So I take a lot of time to educate people on the different disciplines in forensic medicine, because there are very many. And so in my field, it's still me. I'm the only female I know in the country, in East Africa. In most of Africa, actually.
There's something you've mentioned that is a bit of a concern. You're saying there has not been a big turnover. in getting into the workforce. Why is that? Are people not retiring from the pathology science, or what is it?
I think because we generally don't have enough forensic pathologists.
Okay.
The whole world, globally, forensic pathologists are very few.
Okay.
And they have a long way to go before they retire. Some are retired and lecturing,
Yes.
and doing such things. So, but there are no more forensic pathologists coming up. That's the part I don't understand. They're more interested in clinical pathology, so looking into the cause of diseases and other issues to do with disease.
Yeah.
Yeah.
Okay. Let's get into, of course, forensic science itself. What would be one of the biggest challenges for you and other forensic investigators are facing when they're handling cases in Kenya? And let's start in Kenya before we go to the larger East Africa. What are some of the biggest challenges that you're facing in forensic science and the investigators?
Let me talk about that in the context of gender-based violence.
Okay.
So one of the major problems we have, one of the challenges we see is that, especially when you have issues around sexual offenses, after a sexual offense has occurred, there's a very short window period within which treatment and evidence collection can be done.
Okay.
And many times survivors or victims do not seek medical or legal advice or help or assistance within that window period. And that creates a massive problem down the road when they decide they want to have this case prosecuted. Because you don't have the evidence, then the medical report is not available, or it shows that the incident occurred 2 weeks ago. Why did you report so many days later? We are still in a very infantile stage in our criminal justice system where certain principles surrounding rape and violence and abuse and the impact of these kinds of issues is not understood.
Yes.
And so it's expected that if a survivor says that I was defiled, the next question they'll be asked is, did you scream? Did you fight? What were you wearing? Why were you there at that time? All these questions that really have no relevance, and they're even re-traumatizing the victim. And so the timeline, because of the lack of understanding by the key players, that timeline is a very big deal in our context. It's a very, very big problem.
Yes.
Then the other issue is that the service providers in our context also but many times don't have the training in forensic evidence management, knowledge, principles, even principles around trauma-informed care that are very necessary for the success of this case if it is to go forward.
Yes.
And that means that if the police officers, law enforcement, medical service providers, prosecutors, judicial officers, and all that, they may not understand what exactly they don't really understand what forensic evidence is or the value it brings to a particular case. And so a lot of training is required across the board so that evidence is identified.
Yes.
Because you have to first identify it and see, I see a bite mark, that is evidence. I need to take a swab and I need to photograph it. And then I need to document it and put it into words that are accurate and that the court will understand. And then, things like that. There needs to be education around that. The police need to know what to do with it, where evidence is supposed to be taken, how it should be handled. What can I keep? There's once I saw part of a body being placed in a drawer. And I thought,
it can't be preserved, right?
Exactly, you can't do that. We need to take it here. So it's just lack of education, really. And until all these service providers are educated, they'll not be able to do optimal work. And that for me is a big challenge. So we need to come to a place as a nation where forensic evidence, forensic sciences as a whole, whether it's medicine, science, and crime forensics, is taken seriously, and there's enough investment to ensure that first responders, key stakeholders, have the knowledge they need to do a good job.
You have mentioned, of course, evidence during any cases surrounding SGBV.
Yeah.
And I just recalled at the beginning, if you remember, we mentioned Dr. Kizzie Shako, is, of course, the founders of Vunja Kimya.
Yes.
Have you done any works to be able to at least teach about, trauma response for any of these police officers who are handling these cases? What are some of the works that Vunja Kimya has done to make this education about forensic science be more permissible in some of these police officer posts and, just to improve that education for them?
All right. So Vunja Kimya came about in 2015.
Yeah.
When I worked as a police surgeon. And by then I had already identified numerous gaps and challenges within the system. Challenges that survivors were facing, challenges that suspects face, because I find that
suspects face challenges.
Massive challenges.
Which ones?
First of all, they're treated like they're guilty, yet they are suspects. You don't know. It could be either way.
Because you have to be determined by the court.
Yes, there needs to be an investigation, and various experts give their opinions and all that, because you can find someone, and there are few males I've met presented to me as suspects of either homicide or sexual offenses or any kind of violent crime.
Yeah.
And sometimes you just think, did this, some things are not adding up here. Has an examination been done, a proper medical examination? Is evidence collected from the suspect? Because you can't collect evidence from a victim and not the suspect. What will you compare with? That's half-baked information. Have we done any kind of mental status assessment? There's a lot more that should be done, even for suspects.
Yes.
So suspect examination is an aspect of investigations that many times is forgotten or left behind.
Yeah.
And so I also observed from speaking with survivors, suspects, their families, of course, being in court and interacting with all these different stakeholders, that there's a critical gap in knowledge regarding what to do after an offense has occurred, how to do it, how it should be stored, how the chain of evidence from point A to B should be done.
Okay.
The internalizing or using that information. So when I go to court as an expert witness and I say something, I give information about the examination findings of this child who is alleged to have been defiled.
Yes.
Does the prosecutor understand what I'm saying? Do they know what to ask me to bring out more information? Because they can't just go blabbing away. Does the defense counsel understand what I've said? What kind of questions should they be asking? Or does the defendant know what to ask? Does the magistrate know what is happening, what I'm trying to bring out? So for me, that's what brought on Vunja Kimya, just to help survivors know, the public.
Yeah.
Don't let your children walk around at night alone, or they shouldn't be out alone anyway. A 4-year-old being sent to the shop unaccompanied.
There was a time it was possible, but then the world has really changed.
The dangers of online, meeting people online, letting them come into your home, because very many women were raped in those circumstances that I came across, and so on. Just to give information, what is the P3 form? What is the Kenya Police Medical Report form? What is the purpose of this form? Who fills it? From where? What should be done? The process of reporting in different parts of the country, the role of different stakeholders, the need to have the boy child also given mentorship and support, so that it's not just one-sided. We're empowering girls, but we're not empowering boys either. So that's basically what Vunja Kimya is about. However, we, Vunja Kimya team, conducted a lot of self-defense training sessions for children in mainly sexually abused children who have children.
Okay.
Which, I thought that was a good thing to do, because they needed to boost their confidence and also to have the skills to know what to do in such a situation if it ever comes up again. I have done numerous webinars, just educating various groups of people, medics, lawyers, law enforcement, the general public on, the things to do with sexual abuse, child abuse, recognizing the signs of abuse, and what to do about it. But more so in my work as Dr. Kizzie Shako, because I've worked with the Ministry of Health, the police, the judiciary as an advisor to the Chief Justice. I did a lot of work around the same issues. What is forensic science? What is forensic medicine? What is forensic dentistry? What is forensic pathology? What's forensic odontology? There are very many disciplines. Who should do what and how should it be done? And what does this mean? because the legal team also need to understand what it is we are saying. Otherwise, you might say things. We have a lot of misconceptions, and the misconceptions that are in the public also exist in the courtroom.
Yes.
And many times they are not scientific. So bringing awareness on the need to promote science for justice rather than speculation.
I like that push, and especially hearing that you are advising, of course, the Kenyan police and the justice system. I believe that some of the challenges you'd mentioned earlier as forensic investigators is going to go down over time. I know the topic of the Department of Forensic in Kenya as a government is something, we don't always want to touch, but let's dive into it a little bit. The prosecution office, the DPP's office, sort of actually evolved, and we're seeing the DPP's office in different sectors within the country and different counties. That further even educating police officers on how to write charges, further making the court system work when it comes to executing justice. Is this something that we should emulate when it comes to forensic science, to have, an institution that is able to devolve so that this message also reaches down to the courts in different counties?
Well, it's always a good thing to have such certain institutions devolved and accessible across the country. Right now, I think we have 4 government chemists. So our forensic chemists, those who are actively involved in investigations, and their part would be to analyze the samples or evidence that is presented to them by the police. So the police will get the evidence from the crime scene, from the doctor, take it to the government chemist. The forensic scientists there will then analyze and generate a report, which will be presented to the court. So having more of this would be great.
Okay.
But the truth is, it may not necessarily be achievable or sustainable because it's extremely expensive. It costs a lot to run a forensic lab. It is very, very expensive, very capital intense. And so having it, I've heard people say, how come all the hospitals don't have forensic labs? Because it may not work as well as we think it will. More is good, but it also needs a lot of planning, investing, funding, and monitoring and evaluation. We can go back to the discussion about how many scientists we have. Do we even have the human resources to run a whole entire other lab? We also have the DCI Forensic Lab. It was recently opened, and there's a lot of training going on just to ensure that the officers know what to do, because you need mentorship as well in that field by people who have had that experience for very many years, just to ensure that you have quality reports being produced.
I like to hear that. But even as we said that, the DCI's forensic lab has been instituted. One of the biggest scares is when evidence is either manipulated or could disappear. Should these forensic departments all over the country, as much as they're working with the police and also with the justice system, should they be independent? Because one of the truths about our state right now is the lack of independence in the justice system, that judges could be bribed, that police officers could be bribed, and then changing. You see, once we bribe a police officer, then we change the evidence, and we're changing the whole charge sheet. How independent should the forensic department be?
The forensic department should, all forensic departments, whether it's the forensic labs or the forensic personnel, your forensic doctors, dentists, pathologists, all that, would be best placed in an independent setup. For that very reason that you have brought up, autonomy. How autonomous are they? If I work as a forensic doctor and I'm working under the police, how free am I to document what I see rather than what I am being pushed to document? You see, it can create dual obligations and cause a lot of problems, although I really didn't encounter much of that. But it's very important that forensic institutions are independent, because they need to be able to, the experts need to be able to provide reports that are objective, impartial, based on science, and the reports need to they need to have integrity, and it's important for the public to view investigations as ethical. not they could have been tampered with. It's the same way we say justice needs to be seen to be done.
Yes.
It can be done, but we don't see it, and so we are like, there's no justice. But it's because we don't see it. So for me, it's very important for that independence is at the core of forensic work. I have been to many countries, and you'll find, like, for example, where I did my master's degree, the Forensic Institute was anchored or affiliated with a university, and so the police would reach out to the institute and say, okay, we have a rape case here, we have a homicide here, we have this water that we think might be poisoned, so there are toxicologists available. See, they're not being pushed or drawn or conflicting. They're not having conflict within them to write a certain thing. They write what they see, they write what they find, they document what they find. And that's very, very important. But I know it will take a long time before we see that.
We're still hopeful. And I know in your long course of work, Dr. Shako, there have been some victorious moments. Is there, a case where forensic medicine played a major role in securing justice for a victim that you remember and you're willing to share?
I've done so many cases.
Yes.
They're literally in the thousands. But the one that I think I can talk about is the Willie Kimani case. My role in that case was to conduct mental status assessments of the murder suspects. And of course, to examine, and if there's need for evidence collection, that ideally should be done, but it's not routinely done. And so I didn't really play a part in collecting any other, trace evidence or any of that. The autopsies were handled by pathologists, and the samples were collected by police officers at the crime scene, and the government chemist conducted the analysis of the samples collected. There was also some digital evidence. Now, what happened was the evidence that was found included things like cigarette remains, and there was saliva on the cigarette remains, tracing phone records to particular locations, of course, identification of human remains to be sure that this is the person we are looking for, or we think this is so and so, so let's confirm it using DNA analysis. And so that entire case, the way the suspects were pinned to the crime scene, because at the end of the day, forensic investigations are done to reconstruct a possible crime that has taken place. So it's about getting information that can bring the pieces of this puzzle together using science. And so with all this information, the suspects were identified, DNA samples were matching, and that's how that's how the suspects were pinned or tied to this crime that was done. And so that for me was work very well done. I was really happy about the way that ended. Unfortunately, people died.
Of course.
Really unfortunate, but at least the suspects were found. And for me, that's one of the biggest victories, if I may say so.
When justice is served.
Yes, it makes us so happy.
One of the sadder part of justice being served is some of the suspects might get lesser charges because of, either a mental defense. Like the defense can claim that the one who's being prosecuted has a mental illness. And you're called sometimes to give your analogy on this. How regular is this defense put out in Kenya, and how successful is it?
Unfortunately, I wouldn't have the exact figures for that. Actually, I don't think that is even data that's collected. And it should be. But I have rarely come across cases where the defense uses that as an excuse to get a lesser charge. In my personal work. The times that I have encountered people who, suspects who are mentally unwell, they are actually mentally unwell. I have also seen cases where a suspect may be unwell, but the second opinion says that they are not unwell. And this person was definitely not mentally fit to stand trial.
You can tell that they're not.
Yes. I have been in court and seen a suspect who has no idea where he is. He's completely disoriented. He's not understanding anything. And so there's once I asked the magistrate, can I raise a concern? That suspect needs to be in a hospital. He should not be here. He's not fit to stand trial. And I can see it.
Yes.
Sorry, but that's my take. I didn't think it was fair.
How is that advice taken in court? Because, the prosecution has to give, the evidence that beyond reasonable doubt, indeed, this person cannot be held to the same standards as someone who's mentally sane. Do they receive that analogy from a certified forensic specialist well, or do they not?
I don't know if it's well or not, but they do receive it. At least the judicial officer, they usually listen, and they are grateful when you're providing information, providing assistance without, it's always best to put your best foot forward because the legal team may not. Of course, they don't understand medical things, and we don't understand legal things. It's a team effort on some level, and so it's taken very well. Most times.
We hope that kind of interconnection with different departments, the justice system, the legal system, the medical system can work, which you mentioned earlier. When all these departments are working together, you're able to execute justice. I'd like to shift the gear a little bit into mental health, because I understand the works that Vunja Kimya also part of the works is to also speak to people who have either undergone SGPV, and of course to try and ease the mental pain that comes with it. But with that, it would be unfair of us to turn a blind eye to the rise in violent crimes.
Yes.
I know you have seen that. There have been so many violent crimes between 2020 till to date.
Yeah.
And I wonder, is the mental state of Kenyans related to the rise of violent crimes?
That's a very good question. Because I'm in the medical field, I would not want to state too much without data.
Okay, of course.
But I have observed a rise in violent crime, definitely. Actually, over the years, even before COVID, there was just a steady rise. When I started working in the police surgery towards the end of 2012, I would see about 3 sexual offense cases, almost always children, and maybe 2 murder suspects in one day. By the time I was leaving in 2021, or let me say 2019, there were about 10 sexual offense cases, 5 murder suspects. The numbers were just...
In a day?
In one day. And I've not counted intimate partner violence.
Are we talking a certain police area, or are we talking about Nairobi?
In Nairobi.
Okay.
Because the police surgery is only in Nairobi.
Yes.
So what happens is Nairobi has a police surgery that deals with P3 forms.
Okay.
That is how it was. That's how I came to learn about it.
Yes.
But over time, and with police surgeons not always being available, other medical service providers in Nairobi also handle work regarding the P3 form.
Okay.
But across, in other counties, there are no police surgeries. So it's the medical hospitals that do that same kind of work.
Okay.
Yeah. But generally, yes, the violence rate has just gone. It's just been steadily rising. And I think a lot of this can be attributed to higher stress levels, possibly due to poverty as well. It's also important for us to look at in our society, is the law of the land understood? Is it heard? Do people fear getting in trouble with the law? Or do they know that, I'm just going to bribe someone and get out? Because many times we'll hear this. That person has committed this crime, but they are so confident in themselves because they know nothing will happen to them.
Yes.
And many times nothing does happen. You hear all these things, but someone is out free in 1 or 2 days, and it's not understood why. So it's important when looking at violence, what part does every aspect play in creating violence in a particular location?
Yes.
So does the individual have issues around poverty? Do they have mental illnesses? Do they have they substance abusers? Does this individual hang out with violent people? Is their neighborhood full of violence? So violence begets violence. So the more violence that's happening outside, next door, then this can create more violent behavior in the people who live there. What kind of relationships do people have? What do the leaders in the country, national leaders, public figures, what is their take on violence? Do they condemn it or do they not care? All these things affect the way violence will occur in a particular area.
I'm glad you've said that there are aspects of either economical, social, and all this that contribute to violent crimes. The rise of violent crimes in Nairobi, of course, going higher. But when compared to other countries, maybe we're still not, the most violent of people. We look at countries, sadly, like the US, where violence has even gone lower to even children. The gunning of schools and things like that. Do you feel like some of the things that are projected in other countries could be a contribution? What would be the comparison, and what is the way forward when we, sometimes when we see some countries have already, they're ahead of us, either economically and, many other aspects. And for us not to land in the same position, especially socially, because violent crimes are very social, what can we do to, change that curve? Because if we are emulating some of the Western ways, or maybe Eastern ways, if we're looking at China, and we are seeing their violent crimes and the way they are evolving, what can we do to change that curve?
So if we look at femicide, for example, which is the worst expression of gender-based violence, it's on the extreme end.
Yes.
When the UN did a study on this and found that Asia, I think it was Asia, that had a very high level rate of femicide.
Yes.
And Africa was the next in line. And so then the other countries, the other regions followed. But one of the biggest problems we have in Africa is the way our data is collected. Yes, data. We need so much of it, but we are not investing enough on research to identify what is triggering, what are the contributing factors to this violence. What is the rest of the world doing to collect information about femicide? Is there a global framework for documenting femicide? Yes, there is. But are we using it?
Are we applying it?
We need to use it. So that, and not just Kenya, but Uganda, Tanzania, all African countries, if they could all do this, then we can have better data on it, so that we have standardized indicators for violence against women, specifically femicide, and then we can exchange notes and have a better somewhere to start. Without information, you don't have anywhere to start. You have no baseline to work with.
Yes.
And so for me, one of the things that I keep on repeating is we need to do research. We need more data on, and if we can, consider studying perpetrators. For example, those who have been found guilty of committing these kinds of crimes, does anyone take the time to find out about this person? Where were they born? What were they exposed to? How many brothers? What was their parents' marriage like? Were they married? Is it a single mom, single father? Was there violence around them? Were they abused? Are they victims of child abuse? About 30% of children who are abused become abusers. Was there any intervention? If so, what was it? It's unlikely there was intervention, because most people who are in prison actually, that is the best time to give them treatment, because they would otherwise probably never get treatment.
Yes.
What other issues do they have? Any medical conditions? Just to have an idea of what is the profile of perpetrators of femicide in our country. Then I think that way you have you have data to inform prevention. But you can't just say because America is doing this, then it will work here. You can't just copy paste solutions and recommendations. You have to contextualize them. And so we have not gotten to that place where we have this kind of information.
I'm glad you said context. I want to take back. I want to go back and put context of, let's say, the Willie Kimani case. And you have mentioned suspects do deserve to be heard and to know where this comes from. Let's go to that case and look at the suspect in that case. What do you feel were some of the contributors for them to perform that? Oh my God, I'm sorry, not the word perform. For them to do such a violent crime. What contributed to this? If you have any data or, from what you gathered during the court cases. So we can look at, is that something common with some of the violent crime and criminals in Kenya?
I don't have information on what could have contributed, because it was not possible at the time. Actually, my whole entire, work as a police surgeon, getting detailed information was almost impossible because of the numbers. You'd have 100 people waiting to be seen in a day, and then go to court and all that. But I do remember that even the education statuses were different between between them.
Okay.
I don't have much info on that.
When you say education status, what do you mean?
Some were class 8 dropout. Another one finished Form 4 and scored a C, things like that.
Yeah.
Just very different, because I liked to ask such questions. Did you go to school? Until when? Were you ever in trouble? Such things. But generally if I just on a general observation from all these suspects, whether it was physical assault, sexual violence, homicide, one of the things that came out very strongly was the childhood experiences, adverse childhood experiences. A large number of them had gone through some abuse when they were children. Very tumultuous upbringings
by their family members
when they were children. Yes. Many were from single parent homes. Many were from homes without, funding was a problem. They had financial constraints. A good number of them also were substance abusers. Let me say substance users. And so on. But it would be nice to have that kind of information, honestly. I really want to see the day where there's a nice form designed to capture such information, because then we know where the problem is, and have an idea of where to go.
Would this information be better gathered, during prosecution or after sentencing?
Before.
Yeah.
Like for murder suspects, it comes up very early on, because you need to know if this person is fit to stand trial or not.
First of all, yeah.
But for the others, it's not done. It's not done. There's no one asking questions about this particular person who has defiled a child. Tell us about your childhood. No one is doing that.
No one has the time, even because of the log of the cases. There are too many already.
Yeah, exactly. And maybe it's not really a priority, but I think it should be a priority, because otherwise we'll just keep running around. First aid here, first aid there, victims, always talking about victims, and this person has become a victim. The number of victims is rising, but we are not really doing anything to prevent it. So we are always responding, we are not preventing.
And I think we have to be proactive, not reactive.
Yes, we need to be proactive.
Okay.
Yeah.
Sort of a positive turn of events, and I'd like to ask, what are the good key moments you have seen in your career, or whether you feel even in the forensic science in Kenya altogether? Because I know we've talked about challenges, what we're looking for in the future, but there have been some moments where you feel like, I think we're in the right direction. I think we did something good. It'd be great to hear some of them.
I think for me, it's not really about any particular case.
Yes.
But about the entire experience. If I look at it from a bird's eye view, I joined this field, in 2010 when I was working with the forensic and pathology department in the death investigations. That was what I was doing most. And then from end of 2012 to 2021, I worked with the living. Very different scenarios.
Yes.
Between the dead and the living is completely different. And over, in the first 2 years, I had also just begun my master's program. And I had learned so much. And I didn't even know then that it would apply to my work in that moment, which I thought was just divine appointment.
Yes.
And so I learned so much about the issues that our survivors face and our criminal justice system, the cracks in the system. And I was also learning about the international standard. And through that, I became this is where I learned what my passion is about. I was like, I have to do something. I have to say something. The same way Vunja Kimya started, because I thought I have to do something. No one is collecting this information. There's so much data right here.
Yes.
That I think should really be collected on a national scale.
Yeah.
And so I decided to be more vocal, just do things that are not even allowed, write an article in a newspaper, for example, if I get the opportunity, engage in webinars. So I talked a lot about it, and then I began to get called to facilitate training sessions. And in that, you'd find the forensic section is so short. It's like 2 pages when it should be much, much longer, in my view.
Yes.
And over time, so when I would train, I would add a lot. I would pack my trainings with information that's not necessarily in the manual or the guidelines. Or and with time, over a number of years, people began to notice that it's actually making sense to have this kind of content available for medical personnel, for law enforcement, for prosecutors. So I began getting called to train in all these different sectors, judiciary, and others, just to talk about what is this forensic science you're always talking about, and what does it do? How will it improve the system? And for me, the fact that now we have, of course, I'm not going to take credit for this, but I know it played a role in ensuring that now there's a forensic module for medical service providers, educating, training medics on how to collect evidence, what it means, how to handle yourself in court, what it is you can say, what you cannot say. And that for me, I was very happy with that. We also revamped or restructured the P3 form because the way it was insufficient to gather.
Could I get information on when that happened? Because that's a key moment.
That was a key. I was like, I think my job here is done. Now I can go.
Do you remember the year where this changed?
I think it was 2019.
Yes.
Is when the process began. The form was gazetted in 2021. And there's been a lot of requests to explain and give trainings on this form. How is it supposed to work? One of the issues I have is that our service providers are very disjointed. The system in itself is very fragmented. So a survivor will have to go from a hospital to the police, then get a form, go back to the hospital, get it signed, go back to the police. Then, then they have to go to the government chemist to give a sample. It's just, there's so much chaos.
Yes.
And in that fragmentation, you get loss of evidence, time wastage, funds are used. It's very expensive to do all that up and down.
And even it's painful for even the victim and the suspect who is innocent till proven guilty.
Well, yes. That's another discussion we can have if we have time. But so for the victim, all this movement, and then having to, you're on your antiretroviral medication, you're in pain, you're traumatized, you're confused, no one is telling you what you're supposed to do. I've seen parents shouting at their children who have been defiled because they're both stressed. They both need help. This child is hungry. They've been waiting for this one doctor for hours and hours and hours to fill the form. Then they go back to the police. So there's a lot of fragmentation. And in this, you have loss of evidence and survivor fatigue, which can even result in them not proceeding because they're like, will I spend my time and money pursuing this? Or do I just help my child get better and then just try and move on? They move out, they relocate. The burden usually falls on victims to get the help they need because of all this bureaucracy that takes place.
Yes.
And so I've suggested numerous times that we have a one-stop center for addressing physical and sexual assault cases or physical and sexual offense cases, because we don't have one. We don't have a single one-stop center where all the stakeholders are under one roof.
Centralized.
Yeah, they're not centralized. You'll have to go finding them in the different offices. This is done in almost all countries in Africa that I have been to. Many of them.
Except
Kenya doesn't have this model.
Okay, that's a problem.
I hope to see it one day.
Yes.
And so that also, with that in mind, the P3 was revised to ensure that it is comprehensive. You have comprehensive quality information coming out of it. You have sufficient space to document what you need to document. An adequate chain of custody, according to best practice, is captured in the form, and many other things, even a consent section. I know this was a fight because many people don't see why people need to be given consent. Why should I ask you for consent to examine you? But you need to, because if you, in our profession as doctors, you can't just go examining people without consent, whether it's a suspect or a victim. They have to agree. Otherwise, you can be charged with accused of assault yourself, sexually assaulting someone. And it's also the right thing to do. People are autonomous and they need to be able to say, this is what I want, this is what I don't want. Or you can examine me, examine my body, take photos, but don't collect samples. I don't want to involve police. They have the right to do that. And so that was the idea with this revised P3 form, just to provide a better, more holistic approach to examinations.
I'm so happy to hear that there have been great strides that have been made. Yes. So that gives you a sigh of relief, but it's disappointing to hear that other countries right here in Africa have a centralized system to report, SGPV and rape cases.
Yeah.
And yet we're lagging behind.
Yes, we are, unfortunately.
Is it a priority thing or a funding thing?
I think it's a priority thing, really, because what I have observed in our context is a lot of competition. Everyone wants to work in silos. Everyone wants to be seen to be doing this thing very well. Now, if you could just bring all that energy and funding together, it would be so much better. So it's a priority thing in my view.
Do you feel like with certain governments, because I think you've worked in now 3 different governments now, do you feel like there have been changes? Is there a government that has been quick and responsive with this, where others have lagged behind with it? Recently, the president came out to say that he was going to give out certain millions to, counter the issue of femicide in Kenya. And we saw certain, statements said with other governments. But since you have worked in government for, over 3 different governments, do you feel like, there's one government that was able to do it well, or no?
In my view, I think that, even the last government made certain proclamations about providing funding to address gender issues,
yes,
including gender-based violence. Even certain institutions were mentioned as institutions that would get funding and assistance to, kind of just do what it is they need to do. I have not seen much difference. I think what I do see is that there's a lot of personal effort that goes into it. So, for example, you'll find the Nairobi County Gender-Based Violence Coordinator. She's amazing. We'll push and push and push to get certain things up and running.
Yes.
To ensure that there are no clogs in the chain, that things flow for these survivors. So many hospitals now are availing the completion of this P3 form. I'm sure you've heard about the P3 form. It's a really complex issue. But you'll find that many hospitals now do that. Before, when I started this work, it was only the police doctor who had to sign that form, or a public hospital medical officer could sign that form. And it was a really big barrier to justice, because if they're not there, they're not there. And for a very long time, for 20 years, it was just one person in Nairobi who was available to do that before 2 more were posted to work with him. 25 years, actually. Yeah, and so now there's been sort of the evolution of this service, because now even private facilities, some of them are doing that, like Nairobi Women's Gender Violence Recovery Center, MSF, they are now doing it. So I think that's better. There's another government chemist that has come up or is coming up, which is amazing. There's the National Forensic Lab. I mean, there's been progress. It's slow, but we are getting better at it.
I think that's what we want to hear as a country. There is progress and there are changes happening, and you have seen the evolution. Your works at Vunja Kimya is very prominent on talking about child abuse. And one of the things you see every time you go on the site is respond, recognize, and report. Why are these key in making sure that children are safer and these cases are dealt with the right way?
I think for me, at the time I wrote that article, it's because I was very sort of distressed by the number of children I was seeing every day in serious trouble.
Yes.
Either there's dysfunction in the home, and so these children have, they're just loitering around, and that's when they are victimized. or and unfortunately, the reality is most perpetrators are biological fathers. And I couldn't understand why it's like this. And then many times you'll find that I would see a child who has been brought to the office because they were assaulted by, let's say, a teacher. But when you examine, you find out they have marks, scars, bruises everywhere. And then realize that this child has been abused for a much longer time because these injuries are different stages of healing. How come no one said anything? How come why is it coming to the fore now because a teacher did it? Yes. Then you find out that the father actually assaults him a lot more on a regular basis.
Yeah.
Another case that I came across that probably triggered this recognized respond report was I saw a murder suspect. It was a woman. She had been accused of murdering her 11-year-old son. So the story is that she was in her house with this child. The husband or whoever he was had taken off. He'd gone, abandoned them. And this child was found outside, very clean, in a corridor, very cleanly dressed, but he had some injuries on the head.
Okay.
And he looked like he was not breathing. So he was taken to hospital and declared dead on arrival. The neighbors later said that when they were asked these questions, because I asked what did the neighbors say and all that, turns out that they used to hear the child crying a lot. On that particular day, they heard some very loud thuds, like someone or something is being banged up against the ground. And they said that this child was not going to school, would never leave the house. They don't think he was being fed, and that the mother might have had a mental illness. And so my question was, why didn't they say something?
Why was there so much silence during this whole time?
You could have saved a life. So you need to be able to recognize, respond, and report to save the child's life. And if a child goes through these kinds of things, because many people send me, I'm constantly flooded with information from all over Kenya. This child is looking like this. What do you think? Then, you see certain signs, they're malnourished, their hair is thin, they have apathy, they're just sad and not, no expression on their faces. Okay. Maybe they're not moving. This child is not outdoors. Maybe you hear crying a lot. Those are all signs. Or in school, a child who's always crying, hiding under the table. They don't carry food. Maybe you see blood from somewhere. There's also bedwetting, anger. There are various signs that should lead anyone who observes that to question abuse and then report it. So reporting it to the authorities or even anonymously, you can dial 116 and report it. You can go to the police station. You can go to a children's office. There are various avenues people can use to report suspected abuse rather than waiting for a body to appear somewhere.
Yes. I think I've just had a...
Sorry, did I traumatize you?
Yeah, it went a little dark for a minute.
I'm sorry.
But
okay, I'll make you a bit happy.
Okay.
A lot of these children are rescued. Very many children are rescued, peace. And we get very, very happy.
Yes.
We're like, yes.
We've had it. Recognize, respond and report.
Yes.
I want to go a little personal for a minute. Anyone handling such gut-wrenching stories, it calls you to be very empathetic and even sympathetic. But then it also does something to someone's mental health.
Yes.
A lot of doctors see other doctors. Is that something you encourage to experience it? How do you handle dealing with sad cases like this every day and still go home and be, a functional family person?
When I began this work, remember I said that I started with the dead? And that's what I wanted. I liked that work.
Okay.
I thought it was very interesting and intriguing. Then I moved to the living and I thought, how bad can it be? You're just examining and documenting and they go.
Yeah.
Then the more I studied forensics, the more I learned that there's so much more to it with the living. It's actually very intense. And you have to look at issues like, especially with children, or women, you want to know what the home situation is like. Are there other children in the house where the violence occurred? You have to ask so many questions.
Yes.
And with women, another question I always asked was, have you been raped by your husband or your boyfriend? And many times they don't understand. So you explain what that means, and then they say, oh, yeah, I can report that. I'm like, yes, you
because
can.
it's not recognized.
No,
In
it's
many
not
cultures, and
really.
even
Yeah, and it would be difficult to even, some don't even know that that's what's happening. Yeah. And so you also have to do a lot of referrals, connections, and linkages with various other experts to ensure that this individual, their needs are taken care of. But like you say, every victim you see, every suspect you see is leaving you with one more bag to carry.
It's a trauma.
So, oh my God.
Yeah.
So I didn't know that until I was maybe 3 years in, and I was giving a talk on forensics and what the police surgery does. And this psychologist in the room stopped me and said, I have a question. How are you? She asked me, how are you? I was like, what? And she said, I'm very concerned for you because you're young and this line of work is not easy. I thought, noise,
I'm okay.
Yeah, I'm fine. You do what you have to do. By then, it was literally 100 cases a day. Oh my goodness. So later, fast forward is what I'm getting to. I began to feel the impact of these cases on me. I started having palpitations when I'd get into the office. I was constantly sad all the time. I couldn't go home to see my kids. I'd have to find somewhere to go to compose. I felt like I'd get into the office and come out in pieces, and then I have to go somewhere else to just sit, put myself back together, and then go home. So I needed a lot of support from my family. To be able to just get through the day. So what that is it's called vicarious trauma, secondary traumatization, and it is a very, very real threat to one's mental health. Very real. It should not be ignored. And so even when I facilitate trainings, I will always add that, please take care of yourself. Please, you may not feel it now, but you don't want to wait till you feel it. So have a system in place in your medical facility or wherever, whether it's a police station, wherever you work, make sure that you have a system for regular debriefing conducted by a trauma therapist or a clinical psychologist, whoever has the qualifications, to just make sure you're good. And you will have to debrief. There's a lot of things you see that you have to get rid of. Some of them are so bad you can't even talk about them.
How green
and this is
they
in
are.
The living, not the dead.
I think even the question of the living versus the dead, the question of life itself and how fickle it is. I know you have seen it. Practically. And I wouldn't lie, I wouldn't want to be in your position. I'm sorry.
But I think we're all called to do something.
Exactly.
If it's your calling, then you can do it. But if it's not, you will really struggle. It will be hard. And that's another thing that I think is a possible barrier to progress, is that in our context, if you're a medical service provider in a public facility, like a medical officer, this kind of work, you have to do it. You don't choose. So work, it needs to be done, so you do it. And there are people who don't want that kind of work. It's sad, it's depressing, then you also have to deal with the court system and police officers. Many people don't want that. They want to see their sick patients and leave it at that. Treat patients, not medical legal work. But we don't get to choose. And I think choice is very important, because, it's like forcing me to perform cardiothoracic surgery. I would probably faint. But put me in this environment, then I thrive, because we are different and it should be a choice.
Now, one of the things you see with a lot of people who have engaged in careers where they're engaging with a lot of people is that they may take that analogy to their personal lives. So I know sometimes if you're interacting with just normal people, friends and family, and even sometimes strangers, are you able sometimes to see, the gaps and loops in certain stories and analogies? Because there are similarities, as you said. There are certain people, when you see a certain education system and level, you see that this might reflect to how violent crime might be perpetrated. When you see certain children behave a certain way, this might be a reflection of how they're handled at home. Have you had those experiences, and how do you deal with them? Because, if it's not brought to you legally through the police system, this is just an observation. No. You're just witnessing in a restaurant or something.
It's hypervigilance. We are always hypervigilant and constantly scanning. Okay, let me say for myself, I scan everyone.
Allah, have you scanned us?
Yeah, I'm like, she's fine. No, I'm kidding. But there are many times you find yourself really doing a lot of mental gymnastics just to try and read someone, and I find I'm right. And they're shocked. They're like, how do you, this is when one person who asked me if I'm an undercover police officer. I was shocked. So he then confessed that he does drugs. He's a drug dealer. I was like, okay, see you. I just quickly disappeared. But and then when people like me in our field, humanitarian work, you can't stand a child crying. You just immediately want to know what is going on with that child. Are they okay? So your first instinct is to think that's the child in trouble. And so getting therapy is very, very important. It's important to have regular psychotherapy to avoid going down that road of just constant darkness and gloom and everyone is bad and evil. Otherwise, you'll have a very miserable life when you're constantly thinking everyone. So we tend to be very hyper vigilant. You don't want your children having sleepovers. I don't think anyone should allow sleepovers personally. You want to know everything about your children's friends. You don't want your friends traveling around alone. If they say they're going out to drink or to have a few drinks with the girls, I'm like, who are you going with? Where is that?
Can we have a camera on you?
Is there good light? Make sure you cover your drink. Only sip from a bottle. All those things just keep going through your head.
And that is not healthy for life. You have to live life.
No, it's not. It's not healthy. So it's important to make sure it's checked early from the beginning. Don't wait for symptoms. Make sure you are constantly getting checked. And I know many service providers will say, who's going to pay for it? That's a valid question. I think your employer should pay for it. But I know that might not happen. But I think since it's your mind, your body, your life, your children, your family, your friends, where you can get help. And there are many therapists who are willing to help. They're willing to subsidize their prices. There are very passionate therapists out there who are just happy to help others not get into that dark place.
I like that. Before we wind up, there's one question that I always have in my head. It's about objectivity versus being subjective, being an objective person versus being a subjective person. And we witness it with judges, police officers, and a lot of people doing the humanitarian work. Yeah. I've heard you call them service providers, and in my head, it's
technical lingo.
It's like, are they really service? But when I talk to Mishiko Water, so it is service providers. And the service of justice, the delivery of justice, a lot of times in this country, when we talk about GBV cases, and let's start from the charge sheet at the police officer, the police officer's post, we see a lot of subjectiveness in how even the victim is handled. What were you wearing? Those questions, what were you wearing? Where were you? Da, 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 da. And then it trickles down even to some of the judges who have their own personal views. Because at the end of the day, a judge, yes, is a judge, but is a person when they go home.
Exactly.
And they've seen something in the news or their own personal fights with their family members. The question of objectivity versus subjectivity, is it something we will ever be able to conquer as humans, or is it fantasy world?
I think for those who are if we are talking about in the criminal justice system,
yes,
that is a massive, massive problem. A very big one, especially in the courtroom, because what happens is you take these people, whether it's the judicial officer, prosecutor, defense lawyer, whoever it is, even your own family, if you are assaulted, your own family will ask, but didn't I tell you not to be walking down that street at 9 o'clock? The first instinct is not to blame the perpetrator, and that's the person who has committed the crime, not the victim.
Where is that culture from?
A patriarchy, I believe. Yeah. Yes. It's just patriarchy.
Very bad contribution.
Women are objects and should follow instructions, and not, I think that for me is where it all stems from. That women should be protected, which is another way of saying you should not give women freedom to do what they want.
They don't have their own autonomy to make decisions.
Exactly, and they should not dress a certain way. If they do, there are consequences. You will be assaulted, and it's your fault because you should not have provoked that person by wearing a short skirt. it really doesn't make sense. And I always remind people that most of the people who are sexually abused are children who are very young, 2, 3, 4, 5. So you can't tell me she was dressed provocatively. It doesn't apply. It's just about perpetrators choosing to hurt others.
Yes.
So
objectivity
and subjectivity. Yes. I wanted to move to something that we did recently in the judiciary.
Okay.
Was to develop the strategy for sexual and gender-based violence courts. And one of the strategic interventions is to ensure training of judicial officers on issues around trauma-informed care. And part of that training involves and includes the judicial officers understanding who they are. What are their own biases? What are their thoughts on a particular issue? So the facilitator would bring out these things. What do you think if you see this woman dressed like this? Is your first thought, but why was she drunk in a miniskirt with tattoos all over in a club? Of course, what was she thinking? She asked for it. Is that your first thought, or is your first thought something else? So there's a training that is done for judicial officers and others as well to bring out their biases. You have to recognize your own biases and recognize whether you apply them in your work. Do you do that or do you not? Because then that way, once you create awareness on these biases, then judicial officers know, I know I am biased in this way or in that way, and this is what the best practice is, or this is the standard, or this is what I learned about certain issues. And so it's about restructuring the thought process of these service providers to ensure that they are objective in their work. So it's not only in court, it's across all levels. I've seen medics who have documented injuries as much more severe than they actually are.
Why?
Good question. And I see this because I've seen the victim, I've examined, I've seen the medical report that they were given from another facility, and the difference is hours. So there's no way they healed in that time. And so why are these injuries worse on paper than what I'm seeing on the victim? So
what does that do if the injuries are worse? Do the charges go up? What happens?
It could go up, or someone can be found guilty where they were not. Again, there's a lot of knowledge that needs to be shared there, because just because you find, let's say the victim has said, complainant has said that this is what has been done to me, then the doctor examines and finds no injury visible to the naked eye.
Yes.
That doesn't mean that nothing happened. But do the prosecutors and defense counsel and judicial officers, do they understand that no injury does not mean nothing happened? And so that can translate into an acquittal, because there are no injuries, without looking at other things. There are other forensic factors, there's circumstantial evidence. So there are many things that are looked into, but there are many cases where this evidence of no injuries has resulted in, there's no case, there's insufficient evidence.
Okay. I think I've heard so much and learned so much about forensic science. We have mentioned about some of the progresses that we've had in the country, which I think it's really good. I am surprised that Kenya is lagging behind. I usually call us number one in a lot of things. So
in one-stop centers only.
Yeah.
Yeah.
Maybe other things we are number one, but it's good to see that we're, and we have people like yourself, Dr. Kizzie Shako, who is actively working to make sure that forensic science is, growing across the country. And I think I can't wait to see what the future holds. Yeah. She is a consultant, of course, so you can reach out for, personal cases. But I just want to ask, a question, just off the bat. What does life mean to someone who has seen both death and life?
Oh my, I haven't thought about that.
Yeah.
But I think for me, what I took home from this experience was one that you as you are, you need to prioritize and love yourself. And many people don't know what that means.
Okay.
So you need to learn what does it mean to love myself, because you'll find in these workspaces you're under constant pressure all the time. It's very easy to just fall apart. You get chronic illnesses, you get all these things. And then because you're under all that, then even at home, things begin to fall apart, you know? So it's very important to value yourself, know when your time is up, and don't keep clinging on to it. So self-love, self-preservation is critical. I've also learned that, like you say, life is fickle. So you need to make the most of your life when you're on this earth. You need to just make the most of it. And three, especially for the women, because women are mostly the victims of violence and abuse, is stop ignoring red flags.
Okay.
You need to just stop that. We keep seeing these cycles repeat, and you're like, oh my gosh,
yeah,
it's not going to be different 10 years later if the red flags are the same. It's important that women take time to know who they are, what they like, what they don't like, and it's okay to say no. You can say no. You don't have to agree to do things you don't want to do or be with someone you don't want to be with.
yes.
So just, yeah, I think that because many women end up in trouble because of that, you know, not taking certain issues seriously. Then now you get married, you have children, and your whole life is wrapped around that particular aspect.
Yes.
Yeah.
CEO of Vunja Kimya Foundation, Dr. Kizzie Shako. And of course, forensic specialist, has a great message that I have received, and I hope you have as well. Life might be fickle, but you have to look inside and look at the choices that you're making, and most of all, love yourself. The journey to making Kenya, to making sure that violent crime goes low is upon us. Are we doing the right thing socially? Are we educating the people around us? And are we able to recognize, respond, and report?
Yes.
Make sure you're able to do that. Thank you so much for watching. My name is Kate This is The Social Newsroom.